Good evening, everyone. I'm calling to order the Sawyer County Health and Human Services Board meeting on March 11th, 6:30. Can we have roll call, please?
Kay Wilson,
Here.
Tweed Schuman, Marshall Savitsky. He's virtual.
Here.
Chuck Van Etten,
Here.
Jeff Haney, Bill Trepanier, Don Pettit, Carol Pearson, Dr. Dunlap. You have a quorum.
Thank you. Pledge of allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Can I have certification of compliance with the open meeting law?
This meeting was noticed to the public and the news media as required by Section 19.84 of the Wisconsin statutes.
Thank you. We have an agenda for this evening. Are there any changes that anyone would like to present? If not, the agenda is set. Are there any public comments, either from the room or online? Thank you. Number 7, consider approval of the minutes from February 11th. We have a motion and a second to approve the minutes from February. Any discussion? All in favor? Opposed? So carried. Do we have any information from LCO?
I do not have any updates. I think the only thing that I've just been made aware of, I wasn't connecting, but the health center should be opening up mid-April.
April, yes.
And then just kind of let the record reflect that Dr. Dunlap is here too. Okay.
Senior Resource Center information? Marshall, do you have any information?
Not since our last meeting, no.
Okay, thank you. Administration, is there any changes to our acronym term glossary?
Not this time around.
It was suggested to me that that be posted online for others to know.
Oh,
Is there some place?
would
that
we
it-
just post that like under the HHS minutes area or like the where all the board members are? Can we do a link to it from there?
There's a few places.
Oh,
There are a few places on the website that it could go. If you
Okay.
wanted more attention to it, we could do it on the homepage right away, and then we could have a link. You can talk to Mike, but we can put a link on the
Okay.
HHS page. Direct
okay.
people there.
And do it from there. Okay. Okay, we'll figure out a spot.
Okay, thank you.
I will.
And do you have an update for us today?
Just lots of behind the scenes work, working on, Carrie and Alicia have been working on HIPAA documentation, and we've been working on contracts and getting things updated. So lots of legal things behind the scenes. And then something fun is we celebrated Employee Appreciation Week and we used Mardi Gras as the theme. So we had lots of food and fun throughout the week. Probably will be something we decide to celebrate every year because everybody kind of enjoyed that right before Lent. Seemed to be something that went over well. So otherwise, just kind of plugging away, nothing outstanding. I've been also just kind of watching to see what's happening federally and as a state. And really, we just need to see what happens as time goes on, and then we can reflect on what we need to do if we have to pivot or make any changes.
There hasn't anything come down at this point.
Not anything yet, and we're waiting to really see what happens with the federal budget, and then from there, and Shauna is on, so she can talk a little bit just about some of the thoughts on her programs and if there would be any impact there. But at this point, nothing that we're aware of for our immediate future. It's a little early yet. Yep.
Okay. Is that all for
That's all
Updates?
for admin
Okay,
report.
all right. And Aging and Disability Resources
Um,
report?
yeah, it's her report is kind of is standing on its own. I think the one thing to really point out is that we did just receive resignation from Rose Elliott, who is our Adult Protective Services Specialist. And so we are looking at the job description and being able to get that posted ASAP. So if you know anybody who wants to help support a good cause of helping protecting the adults in our area, have them be on the lookout for applying for a position with us. Anybody have any questions on the report that Carol submitted? Pretty standard for what she
I don't
usually
think-
submits.
See anything outstandingly different than any other report? Okay, we'll move on to behavior. Oh,
I just have one thing Julie said that we are not seen online, so our camera is not working in the boardroom.
Oh, well. It was, because I saw it. Let me see. Sharing the screen, and I have this.
Look at your video and just see what it's pulling. If you click on the top one, will that make a difference? Oops. Oh,
there you go.
oh. Just had to click on it, I guess.
All
Okay, thank you, Julie, for letting us know.
We're moving on to behavioral health. We have a report there.
Yep, Alicia has a report. It's pretty standard. I don't know if there has been any updates from you either, has there? Nothing major? So those of you that are online, we received more referrals for CLTS, so that program continues to increase. And last month, we reported out that Haley Sands is now helping out with that program to help pick up some of that slack. We cannot have a waiting list with that program. There are counties who are starting to get notices and will be docked if they have a waiting list on that program. So you need to hire to meet the need. But we have not had a waiting list, so they're doing awesome with that. But
And that's a state mandate?
it's a state mandate, yep.
Hmm.
And that is one of the, it's fully funded too, so it's not, there's a lot of state mandates that are not fully funded. This happens to be one that is, so that's helpful. Moving on then from the behavioral health report, if there are no questions. We have added a report from the community support program and mobile crisis. So this is just a beginning of being able to kind of outline some of the work that Northland Counseling is doing for us along the way. And we'll get this kind of geared up more so it comes to us with monthly numbers and we can kind of see where things go across the board. Does anybody have any questions on Northland Counseling's report? And at some point, we can also invite Caitlin and Cole here to talk about the programming, if that would be of interest too. Yep. Caitlin or Cole, did you want to add anything to your report?
Hi. As a newbie of board reports, I don't really, if there's other things that you guys would think would be helpful to include every month, I'm more than happy to do that. The only thing is that crisis has been kind of kicking off a little bit more this month, but yeah, overall pretty status quo, I would say.
Thank you, Caitlin. And actually, that is we were pretty quiet. I think we commented on that for a couple of months with Joe's transition and not much happening. And I was waiting for the ball to drop, and it did. And so the good thing about that getting busier, though, it's helping us be able to kind of work out some of the kinks between transitioning from Joe being on board and in-house full-time to him giving us providing consultation, and Caitlin and me and the team kind of trying to figure out and pick up those pieces and manage through. So I think we're making some good headway through it. I'm not feeling like we have any major roadblocks. I'm thankful for the processes that we have set up right now. Okay. There's not going to be much for mental health expenses report, but that is your standard report that's in there. We're starting off, though, with getting money in from Winnebago rather than paying out. So starts the year off well. So that's the only thing to note there. And no changes in these 4 clients on item D. That continues to stay the same. Again, hoping that at some point this year we'll be able to do an analysis on the client B and find out a way to have a less restrictive and or at least less costly option for providing care.
So where would that person be placed?
We would have to develop, we'd probably put out a request for proposals to, like, could somebody do intensive adult protective care in a home or adult, it would have to be a couple of people. It just, we'll have to see.
Where is that person?
You know what, I don't remember, not in the county though. Can't quite remember where that town is, but out of town. So and also the closer we can get people, the easier it is for Caitlin's team to help support with CSP as well. Because then we can get additional intensive services. So those are the things that we need to be looking at in 25.
Moving on to Child and Youth Family Services, the Child Protective Services Report.
Okay. The standard report for Child Protective Services is here. Nothing outstanding on that report. There's no questions, but we can move on to the YJ report. I think what's of significance is that we had a quiet month for mental health and we had a quiet month for YJ referrals. So we always know that that doesn't continue to exist, but
You had no referrals in January?
I know, isn't that crazy? That's okay. We need to get some of these cases kind of through. So it would be nice to have a couple months like that, but I know that that's not happening.
Oh, yeah, plenty of ongoing.
Yes, we have plenty of ongoing cases. One of the, let's see, I put that? No, that's D. I'll talk about that when we get to D. Otherwise, nothing, we've got the same amount of out-of-home placements that we've been having. If we go on to C, it's the standard children in substitute care report. And there is the roll-up on page 20 of being able to do the comparisons between the years 2020 to 2024. Reducing some costs in treatment foster care, which is an expensive place to have kids. And then for youth diversion and truancy update, we are, the potential candidate declined the position that we had for that. But we have re-interviewed and we are hopeful to have a candidate. So we'll see, hopefully we can have something in place in the next couple of weeks for that. In addition, we've talked about the additional funding that we had received for grants to be able to contract for services with Sorona Recovery. And they have 2 workers that will actually be starting tomorrow. And they'll be providing intensive home services to be able to help families work on parenting, mental health, substance use, all kinds of different things that might be impeding the families from succeeding. And that is in hopes, as we work through that, is that we're able to give the parents and the families the skills to communicate and live together healthy without having to take the kids out of home. And these are kids that would be referred to us through YJ programs, so they're either justice involved or they're on the verge of justice involved, and we're looking at diversion with them. So that's the focus of that program. And then hopefully that eventually will decline the amount of caseload that we have and also out-of-home placements.
And who is Sorona?
Sorona Recovery is a sister to Justice Point, and I forgot the overarching company, and I don't think I have anybody on that knows that. Justice Point is who administers the diversion programs on the adult side with our jail. So we've been working with Justice Point for a number of years as a county, and Sorona Recovery focuses on the youth side of things versus the adult side of things.
So they've been helping you with youth diversion until we get someone.
We will continue to contract for those 2 workers through that federal grants that we received. The youth truancy and diversion worker, we will be hiring, and that will be focused mainly on working with the schools. Like that'll be super early on, getting the kids coming to school, helping to promote that the best place for kids is in school. Why is that important? There'll be all kinds of campaigning and different things that go on. Actually, this was the thing that I was going to say earlier. We just met with Ben Tran. And he is somebody that has been working with LCO on programs with like their Falcon program for the fentanyl abuse and different things. And he is going to help us with really kind of changing the messaging with the importance of schools. So he'll help focus in on the tribe and help with that messaging. And then we'll kind of message from the county side. But the goal is to really do this as we are one community and not 2 communities. We all need to have that same value of getting our kids in school. Carol? Ben Tran is somebody, he has been working with a number of tribes, and he does a lot of marketing and communication. He used to have a very high profile job where he worked in multiple countries across the world doing things, and now he has turned his focus to be smaller and really focusing in on working with tribes and helping them be successful. So he identifies areas that they could work on as a tribe and move forward. And one of my understanding is they met him at a conference and then really wanted to start focusing in on fentanyl awareness and substance misuse with the tribe. And so that's where he started. Yeah, very culturally sensitive. So hoping to have that combined messaging. And then E is just the 161 agreement. It's just the background document. So when you do get the 161 agreement coming through to be able to see, it just gives you that little bit of background of why we're doing that. So just providing that for your information. Yes.
I read through it and I know what the 161 is. I can't remember what the time frame was for children when they're in placement. Wasn't that changed about 4 years ago? they can only be in placement for so long before there's an active role to take them out of and put them
Oh,
permanent.
we want to get the move to permanency between 18 and 24 months, I believe.
Okay.
Yes.
I couldn't remember.
Yes,
Okay.
you're testing my knowledge. Okay, so that's it on that, if there aren't any other questions.
Thank you.
Mhm.
Moving on to economic support.
Okay, we have Shauna's standard report in there, and then Shauna, I believe, is on the line.
So, just kind of a recap from January. We're staying pretty status quo on our caseload size, a little bit of an increase with Medicaid. So for Sawyer County, 1,123 food share cases, 1,959 recipients, $290,000 in food share benefits issued for that month. Medicaid cases, total 2,595, recipients 4,082, and then further breaking down Badger Care, EBD, and MAP cases. Our long-term care cases, those are people in either residential care nursing homes or receiving family care services. And then our child care cases. And then below January 2025, the Northern Income Maintenance Consortium, these are some of their rates as far as our call center. We answered 7,882 calls in the month of January. Our longest wait time is 62 minutes, which does seem like a long time. However, in other areas of the state, that's significantly a higher time frame of waiting. Food share applications, 1,243, and we're almost at 100% for processing them timely. We did meet 100% on our Medicaid applications and renewals, and the food share 6-month report forms all over 95%. I can say that we've definitely had an increase in our walk-in traffic in the agency, especially over like the lunch hour, which is to be expected, for our families that are working. That's when they can come in and see us and drop off verifications. The call center is closed on Thursday for part of the day, and then to offer a flexible schedule to try to work on our retention for economic support staff. The consortium call center closes at 2 p.m. on Friday, so that also increases our walk-in traffic here at the local agency to serve those members. So not too much has changed. To cover what Julia had mentioned earlier at the start of the meeting is just kind of some of the information that is on the news or in the media as far as the budget and the concerns about public assistance benefits continuing or being cut. That certainly has had a little bit of an increase in our calls and the types of calls that we get. People just very concerned about not only public assistance benefits, but their Social Security, their veterans benefits. I mean, we're kind of their call for all of those questions. And right now, the state is providing us with some talking points to help our members. Basically, what we can tell them right now is that there hasn't been any changes made in Medicaid services. They're still, going to receive their Medicaid benefits, no cuts there. Basically, what they're hearing in the news is more on the proposed budget. And then as far as the now, especially in this week, is whether or not they vote to keep funding going. And so that goes through Friday, March 14th. We can ensure that our members, I mean, we're already here March 11th, but no changes have been made in their March food share benefits. They're still getting their March benefits. And then we do not have any information that there's any changes in their Medicaid. So hopefully we'll know more after Friday. But these are some of the calls as local representatives, you know, as board members. I mean, I could see potentially maybe some of you might get these types of calls too. So I did send out some talking points that supervisors or our ES workers can use, and if you would be interested in that, I did send it to Julia so we could send that out to board members as well. And
We
that's all I have.
received any calls? Has anyone received any calls? No, I
yet.
haven't either. But that might be good information to have.
We
in
can
our-
get that sent out.
Yeah,
It just-
or
it
maybe
just
we
came
should
through.
wait till Friday, like she mentioned, because
Yeah.
that might change.
It will probably change. The
I'm
talking
hopeful.
points, the talking points right now is really that their benefits are not changing at this point. So I think that's really what, from your perspective, is until we know more. Okay, anything else for Shauna?
No, thank you.
We have the public health report, and Julie is out of town, but she is online as well. She's probably sitting in the
Yes.
hotel just like you were, Liz, the other day.
Indeed. Good evening. I did just want to mention that on the public, after I submitted the written report, we did get the evaluation and work plan from DATCAP that came in on Thursday of last week. So our team will be looking at that and sitting down and writing the plan. We will meet with DATCAP in early April to go over that, as well as items that they would like to address moving forward. So I did want to give an update on that. We are seeing decreases in respiratory illness right now. So we're kind of on the decline with that for those of you who are following that. And that is all I have. Any questions? Thank
Well,
you.
that was easy.
I know. I told you, the reports are pretty self-explanatory tonight and not a whole lot of new stuff on.
Thank you, Julie. Go back to your vacation or wherever
Well,
you are.
She's at a conference.
Yes, for emergency management. So
Let's move on to fiscal, the budget performance.
Well, we only have 1 month in, so nothing too exciting there. So we did though just keep the standard reports in just so that you are getting the reports that you're accustomed to getting. So both A and B do not have a whole lot in them.
Okay.
C and D though do, and they've been kind of revised a little bit, so just wanted to kind of talk through that. So the budget or the purchase service recap report, if it looks a little bit different, it's because Tanya's been trying to rename things so they make more sense to where they fit. The one thing though that's on here, and we maybe need to figure out a better way to be able to do it, is you're going to see overspending in areas where it says overspent, and basically it's because we had money either that got transferred over into the next year that we didn't budget for, and or a grant came in. Well, along the budget process where we got funding and it wasn't part of the budget process. So that's where it gets a little wonky when we have some spending, but it's covered by funding. So I don't know if I explained it, if that makes sense well, but it looks like we overspent an area and we didn't have funds for it and just chose to spend money. So we'll try to figure out a way to better take a look at that, because I think that's the one thing that makes it like if somebody's just looking at that, like, what are you guys doing?
Or they're both listed as grants.
Well, and maybe that is enough for you guys to just know that that's how, when they say other public health grants, to know that that's funding that is there. And we can leave it that way. Or maybe I just need to have a little asterisk on the bottom, just for people that would only be looking at the report and not really be listening on our meeting. So that's the one thing I have on that. And then we have the receipt recap, which is pretty new in the year too, so we usually don't get a whole lot of funding in yet. That's it. Are you surprised we're getting through this that fast? So, what is next on here?
I have one question about the grant.
Could you turn on your?
Oh, it didn't turn on. There
There
it
you
is.
go.
There you go. The grants I had a question about. Are these all renewable grants annually, or how are these grants that we're talking about
So
obtained?
some of the ones that are on here are not renewable. They're just grants that are going
Okay.
or whatnot. But the grants for the ones that we're doing with the diversion with the Sorona recovery,
Mhm.
those are renewable up to 4 years. So hopefully they're renewable up to 4 years, because those are federal grants and now we don't know really what's happening, but we're going to work on the assumption that they are, and we're going to make the most headway that we can. The goal would be, as we start to really see things change, then we can kind of handle and do staffing differently with what we have in-house, and not needing all of that extra support.
So who is writing the grant proposals then? Each supervisor in the department?
So Carrie Mann, the deputy
Right.
director, when we brought her in, she has been taken a huge lift on writing some of these grants. Some of the other areas where we get grants would be like emergency preparedness, to help with our MRC projects. Those Joyce is usually writing directly. Some other grants are called block grants, so they're just grants you don't write for and you just get them every
Right.
year. So there's a variety of different ways, and maybe that might be a good thing to write up in the fiscal report, just as like, how does funding come in? What
I think
kind
it's
of
going to
work
be
do
very
we do?
important to watch our grant process.
Yeah,
Because of the possible cuts we may have, so that we grab whatever we can.
yeah, and
It's
we'll
out there.
probably be needing to look at more private funded
Right,
areas too, so,
right, because we can't afford cuts.
no. So,
Thank you.
yes.
Thank you, Carol. That's a good perspective. All right, well. Do we have any updates from any committees that anyone has attended? Or any correspondence from conferences and meetings?
Oh, I forgot, it is Human Services Day at the Capitol on March 27th. And I can send that out if anybody wants to register to go. And I'm not absolutely sure what my schedule looks like. Julie and I will be actually going down to New Mexico next week for 3 days. And that is going to be actually focused in on looking at jails, mental health, medication-assisted therapy. Part of the funding that that they've gotten on that side, they needed to have human services and health connected on those conversations. And so we'll be going down and looking at 2 or 3 different jails and how they're set up. And that will be also with the jail administrator and chief deputy. So that'll be happening. So we'll be able to bring that back as we move forward. And those are fully funded through a grant as well. So it's not coming out of county funds.
Excellent. Any future agenda items that we would like to address? Is that alternative transportation system still working well?
Yep. And I actually, if Marshall's still on, I don't know if you are getting any calls from law enforcement to help assist with anything.
We haven't used them yet at the city of Hayward, I know. I believe you used them a few months ago, and that's the only case I know of
Yep.
so far with them. But they are still running, so.
Yep, and we use that company especially for our youth transports that we are unable to do on our own, so.
Okay, well, we are adjourned.
Thank you.
Thank you, everyone.
Goodbye. Thank you.